have to start by acknowledging that there is no shortcuts. We have to involve almost everyone into prevention, and the only way to do that is by organizing ourselves, both civil society but also organizing communities into some form of awareness why prevention is important. It means you are bringing both women, men, but also non-gender binary people, because we're not only talking about prevention in the context of heterosexual relationships, we're talking about prevention for everybody, prevention that is inclusive of everybody. Then that means that movement, it can't be a boardroom movement. It has to be a grassroots entrenched movement. We have to do things properly by going back to the basics. Back to the basics by putting more efforts in popularizing HIV prevention and its politics, because it deals with the structural barriers to why many people are unable to prevent themselves from HIV. It's important for people to understand their bodies and issues around pleasure, because when we introduce products such as condoms, microbicides, rings, vaccines, people must be able to locate those products within the bigger politics of the body, not just about that part where the products is targeting in their bodies. By doing it that way, then at least it organizes people towards collective agency, not just you, that your body's health and protection of your body and your body pleasure is not just about you. It's also about your partner, it's also about your family, it's also about your community. Because a lot of the structural challenges that many people are struggling with are outside of their bodies. It's the interaction of the body and their society. That's why you can't build a movement by only focusing on the individual or by only zooming into one body part. Of course, I'm a believer of social movements. I believe it is through critical mass that we can bring change. I believe that it's through people's power that policies can change. It's through people's power that we can even shift social dynamics. It's too much of a burden for individuals to be given the responsibility alone to resolve their own health, as if they are the only ones responsible for ill health, whereas it's a societal ill health, it's a global ill health. And in Africa, we need that more than anyone. We have the highest incidences of HIV. Socio-economic conditions in Africa really propel us to do this right. Do it properly, where we are not just focusing about HIV, but we locate the disease and its impact within the socio-economic conditions of many women and men who live in our context. It has to be an Africa continental movement where we can learn from each other, but we can also make sure that when we win in one part, that win is felt everywhere. When we win in terms of having these social transformative conversations in West Africa, we can feel them in Southern Africa. In fact, we can actually see the impact in Southern Africa. That for me means that we can't afford in 2018 going forward to work in silos, because almost our problems are almost the same. We are faced with the same problems, and we are continuously, as people who have been marginalized through imperialism, through colonialism, continue to be marginalized today by ills of society. So we have to work together. We didn't come to liberation on our own. We worked together as a continent. And HIV needs us to go back. We have the tools, we have leaders in society, and now we don't need anyone's permission. We know we can do it. We've liberated ourselves. We can end HIV.